So excited to be here with Dr. Christine Horner. I just had such an amazing consultation with her in what was it, like 20 or 30 minutes, and asked her if she would be kind enough to come and share some of her amazingness with you all. And she was gracious enough to do that. So thank you for being here, Dr. Horner.
Oh, you're so welcome. It's my pleasure.
Yeah, I would love to start out. Well, first, I'll start out with a question I ask everyone, which is, what does true wellness mean to you?
So that's a really good question. So in Western medicine, I learned nothing about health. So I'm a board certified surgeon and general surgery, plastic surgery, and was in residency forever and then in practice for like 12 years as a plastic surgeon. But I truly never learned how to create health. I only learned how to suppress, symptoms using pharmaceuticals or cutting things out. Um, and it wasn't until I did a lot of breast reconstructive surgery, and I got really alarmed when I started operating on women in their 20s for breast cancer. And I thought, something is wrong here. So I started going through the medical research, just checking what, if anything, women could do to help to lower the risk. And this was like almost 30 years ago, and I had no idea what I was going to find, but it turned out that there was thousands of studies at that time showing that it's mostly diet and lifestyle related. In fact, like 95% of, women could potentially prevent themselves, of the cases of breast cancer could be preventable. But so when I looked at that, then the universe kind of converged on me to have me do some other things. But I ended up learning about Ayurveda, the system of medicine from India. So I learned transcendental meditation, and I was like totally blown away by it. And then the instructor said, well, if you want to know more about the system of medicine, it's called Ayurveda. And I'm embarrassed to say I'd never heard of it, before. And so he's like, you need to go to Fairfield, Iowa and experience the detoxification program, Panchakarma, and to really experience Ayurveda. So that's what I did. And 48 hours into it, I looked in the mirror and I looked 10 years younger and never felt better in my life. And I thought, oh my God, these people know something. So then I studied Ayurveda like crazy. And this is a system of medicine that teaches you exactly how to be well, how to create health. It's kind of like they understand the natural laws, of the universe that govern us. And it's like this, the instruction book, if you follow these rules or natural laws, you're going to be super healthy and in balance. If you violate those laws, you're going to develop imbalances and then eventually diseases. So that was a long response.
I love it. And it combined the next question, which is what's your background? So now we know. Fantastic. We're just consolidating all the questions. No, I love it. And in fact, I just recently learned about Panchakarma because I had a client who was interested in doing a repeat session. And I was like, I don't know what that is. So let me educate myself.
Yeah.
And then I saw that you had information on your website about it. And so yeah, so fascinating. So you actually went through the process, which is amazing
Yeah, probably 20 times probably at this point.
Wow, amazing.
Yeah. Oh, yeah. I think it's extremely important. On Ayurveda, they understand that we need to detoxify ourselves because everybody's exposed to, horrible toxins. And 5,000 years ago, that's how old, Ayurveda is, with its recommendations. They recommended detoxification multiple times a year. And it was mostly based on the fact that we accumulate, toxins in our body from stress, basically. And then we don't digest well, and those kind of undigested particles are things that clog our system. And I'm like, well, fast forward a few thousand years, and it's like, we've got all these incredible chemicals in our air, or, food or water, and we just have a tremendous amount of toxins, in our body. So, the full philosophy of it, which is really true, is that nothing works, as far as medications or herbs or things very well, unless you get, the toxins out of your body so that things can kind of flow. So yeah, that's a very important, concept that we do not have in Western medicine.
Mhm. And that's what I love so much about this conversation, is because you're bringing in, so my husband's a physician too, and I don't even know if we talked about that, but you're bringing in what I know from his training as well. And even from my own training in pharmacy school, is the lack of all of this, the lack of sharing of all this or understanding of all of this,
Mhm.
and now diving deep into it. So you were performing plastic surgery. You started to notice younger women in their 20s coming in with breast cancer. And so you just started to dive in and research more. And what did you find?
Well, again, what I found was that it's all basically diet and lifestyle related. The genetic form only affects about 5%, of people that get breast cancer, and the rest of it, it's all, diet and lifestyle, and emotions, play a huge role, with it too. So, when I learned all that, and then I learned Ayurveda, I just thought, people need to know this information. So I pitched the television stations. I was living in Cincinnati, Ohio at the time. Now I'm in beautiful San Diego. But, I said, hey, let me be your on-air doctor doing a segment on complementary and alternative medicine. And they said, okay. So I did. I was on ABC and then NBC, for 3 years. And then I got syndicated. And then I just, I was trying to do my practice at the same time. And then I woke up one morning and thought, I can't do this, and then I realized that I felt like I could do so much more good for people by teaching them how to become and stay healthy naturally and avoid the knife, and at that time, again, 30 years ago, there wasn't any conversation about natural health in our, in our culture. And I never even had a course in nutrition throughout my entire medical education, which is just like ridiculous.
Mm.
So anyway, I decided to leave my practice and just really dedicate myself full time to teaching people about how to become and stay healthy naturally. So I've written a couple of award-winning books. I did television for years, flew all over the country, doing interviews everywhere, and wrote, for national magazines and that kind of thing. So I've been doing that for the last 20 some odd years.
I love it. I mean, you went from being on the other side of, okay, let's cut out what's already here, and you can't do anything about that now other than cut it out, to how about we just don't get to this point? And what I would really love to start with is our testing system in the US, and what is promoted with regard to preventative testing. And
Mhm.
for myself, I just sort of had like an inner knowing that my body just didn't want the mammogram. I mean, I don't know that anybody's body actually wants the mammogram, but
Yes,
I
right.
just was like so resistant to it.
Uh-huh.
And I'm like, there's got to be another way. So I learned about thermography, and that's how I landed in your world. And I, against my new gynecologist advice, because I was
Right.
told,
Uh-huh.
mammogram is the gold standard, and this is, you have to have that, and then you can have your ultrasound, and then now we'll tack on an MRI. And I'm like, so three image, three testing every year. That seems, when I don't have any like
Right.
noticeable issues, seems a little intense to me. And so she told me, definitely no on the thermography. It's only going to result in you needing a mammogram. And I still did what I wanted to do, which is how I
Uh-huh.
landed in your world, because you read my thermogram. So
Right.
can you tell me a little bit about sort of the evolution, and why we're at this place in the US of, this is just the way it is. It's
Yes,
yearly
yes.
mammograms,
Yeah,
and that's
yeah.
the only way it
Uh-huh.
is.
Yeah,
Yeah.
yeah, yeah. I know it's just really crazy. So I was involved in politics and national policies, early on, because insurance companies stopped paying for breast reconstruction, following mastectomy. So I got really mad, and I, ended up starting this whole national campaign and meeting with President Clinton and Hillary. And anyway, we got it passed. So I'm very familiar with how our system works, the medical system, and so forth too. So, uh, you know, it comes down to money. And I mean, it is so sad to say this, that our businesses, were kind of like run by corporations, and the corporations are interested in making money at the expense of doing the right thing for people. So I got introduced to thermal imaging about 20 years ago. And when I first got introduced to it, I just thought, wow, this is so amazing, because here you've got this completely harmless, technology that can give us a heads up, that physiologically things are not looking good, that, you may progress to go on to develop breast cancer. And then you can interrupt that process. So that's I did all this research for my first book was on all the natural approaches to protecting against and fighting breast cancer. So we know all the things that you need to avoid because they contribute to it. We need all the things you need to favor because they, help to protect you against it. So it's pretty easy when kind of like all the do's and don'ts with it. And so later in my career, so I was doing the television, writing books and so forth then. And then probably about 7-8 years ago, I just thought, I'm going to investigate becoming a physician interpreter for, thermal imaging. And so that's what I did. I got, I researched all the different, companies, and I found one that was the best by far, and, best camera equipment and resolution and reports, and, all those kinds of things are super important that most people don't think about, but it's like super important because there's not a real good kind of standardization in the thermography world. So there's some companies that have very poor resolution cameras. And so just like when we did the big study on mammography, when they were looking at the different equipment that was being used to do mammograms, and they found that some were so poor, it was like better not to get one at all because it would, miss so much. So we kind of have that in the thermography world. There's a bunch of people working on it to try to get it, more standardized. But anyway, I this one company that I found is really extraordinary, and they have the, highest resolution and so forth. So, so I started doing the interpretations for them. And then in that process, I learned so much more that thermal imaging can be used for besides, just, looking at the breasts. And then I just became completely passionate about it because it truly is a preventative tool. None of the other tests that we have are preventative. So if we just kind of go back to the breast, issues again. So, as far as the equipment that we have for, kind of analyzing what's going on with the breast, all the tests are anatomical. So there's ultrasound, the MRI scan, the mammograms. I mean, CAT scans aren't normally used for the breast, but those are the other imaging tools that we have. And so what these tests do is they take like a cross section of the human body and they show the underlying architecture. And the only thing that they're able to pick up is when there's been a structural change to the body. So in other words, they only tell you about something that you already have. Whereas thermal imaging, it's an infrared picture of the body, and it's picking up the infrared energy from the body in the form of heat. And I always kind of say, well, if we look at it in the most simplistic level, all it's really doing is measuring the surface temperature of the skin. Like that's it. Now, the software program will assign a color to every temperature. And so that's what allows us to have an image that's produced on the computer screen. And then the whole reason that thermal imaging is a really valuable medical tool is because there's an interaction, we'll say, with the sympathetic nervous system, which then innervates the skin. And whenever there's any kind of underlying imbalances, dysfunctions, injuries, infections, things going on, the overlying skin temperature is going to change. So I can, I'm trained to know exactly what the thermal pattern should look like for each area of the body. The body's also very symmetrical. So we're looking, does one side, match the other side? So whenever I see something that varies from that, or is off from that, that's what draws my attention, to say, okay, there's something going on here. So, we're finding, just as a for instance, most of the time when I see different patterns, that person may have no symptoms, no awareness of it. And so we're picking up imbalances before, somebody gets these structural changes, and then we can, interrupt, the process of it going on to, form a disease. And that's particularly true, for breast cancer and the breast. We'll see these kind of physiological changes. They look like heat and vascular patterns. There's all sorts of different guidelines that have been established as far as, what's considered significant or not. There's been 800 studies published in the medical literature on the topic of breast thermal imaging and breast cancer. So, when they say, oh, there's not the research, I'm sorry, there's 800 published studies. So what it shows us is that if a woman has some of these, significant patterns, and of course, the more there are, the more significant it is, but it tells us that there's an increased future risk of developing breast cancer. Now, what's amazing is that the breasts are super sensitive to diet and lifestyle and so forth. So when I, find people that have this, kind of an early warning sign of a, increased future risk, then we interrupt that pattern by doing some, really beneficial improvements in diet and lifestyle. So that's the whole point of my book, is to help people to know exactly, what they need to focus on. And then there's some key nutritional supplements, that we use. And so then we'll do imaging of a person just 3 months after the time that they started those supplements and the improved diet and lifestyle. And a lot of times all those patterns are completely gone. I mean, it's like unbelievable. So we have this, again, it's completely safe. It doesn't use radiation. It's pain-free. It's FDA approved. So we have this totally safe, technology that can allow us to monitor health. And it's just, to me, it's this invaluable preventative tool that everyone, should take advantage of. And if they want to have the best health ever.
It's really so fascinating to me. I mean, you showed me some of those sort of before and afters, and it was like hard to believe that that was the same person, and not even just from the breast, but also the guy that you showed me who drank the alcohol, and just the inflammatory response that occurred even 24 hours after the alcohol. Like thinking, most people think like, okay, I'm good, it's all been washed out. But so it's pretty fascinating. And I also think what's fascinating is what I see is my mindset going into this. So when I go into a mammogram, I'm going in anxious. I don't know what they're going to find.
Right.
I'm like, there's just all of this anxiety that I'm noticing in my body. And then it's like, okay, you have dense breasts, like 50% of women, we got to do the ultrasound. And so now we're stressed about the ultrasound, like just stress after stress. And then, okay, I get the all clear. And then I go back to my regular life, right? Versus what happened with this was I did the thermal imaging and I had a consultation with you, and you told me there was some lymphatic congestion, and I had no idea. I mean, I would have had no idea what other tests would have told me I had lymphatic congestion. No test. And so I'm like, okay, I don't really have any idea why I have lymphatic congestion, but I'll go get a lymphatic drainage massage. And I did. And I felt like absolute trash after that. I mean, right after I felt great. The day after I felt like trash. And I was like, well, isn't this confirmatory that I must have had congestion? Because I don't know what they just mobilized, but it needed to be mobilized.
Right.
So, and then I just sat in complete awe over how would I've ever known that? So now to me, it's like, this is like something we can take action on. Like I'm like, yeah, let's get the test. What do we need to do, to get better, to optimize?
Yeah. So, you brought up a good point there too. So thermal imaging is something that shows us, all sorts of things that no other test does. And one thing that it shows us that is just so incredibly important is inflammation in the body. I mean, so we can see focal areas of inflammation, let's say like in a wrist or a knee or something like that. But it also shows us these very distinct patterns that are called mottling, M-O-T-T-L-I-N-G patterns, when someone has inflammation in their body. So we can actually get a picture and kind of like measure, okay, how extensive is the inflammation in this person's body, based on the concentration of these patterns, the intensity of the patterns, the locations of the patterns, and so forth. And then we can monitor them, like if you put someone on a anti-inflammatory type program, then we can monitor to make sure it's working, so, over time. But we know inflammation is kind of the key thing that drives all the different chronic diseases, from dementia to heart disease to arthritis to cancers like breast, prostate, and colon cancer, are really driven by inflammation, tremendously. So that gives us, unbelievable information and power in helping, people. Because again, most people, they have no idea, that it's there. So anyway, that's real cool. And then oftentimes too, I'll see where people might have an infection in a root canal, under a root canal. And the dentist, when they're looking in your mouth, everything looks normal. When they do an x-ray, everything looks normal. And then we'll do thermal imaging and they'll be like, holy cow. I mean, there's like this big, huge, focus of infection. And then I send them back to the dentist and they, sure enough, they've got an infection going on that there was no other way, to be able to tell. Yeah.
It's really just amazing that we don't know about this on more of a mainstream, and that our physicians are not knowledgeable enough to even feel comfortable recommending it. So talk a little bit about the concept of sort of standard of care and guideline directed care, and where we're going wrong with that.
Okay. Well, again, it's money driven because there's been so a few years ago, let's just say 5-6 years ago, it's been, I think, there were a number of long-term studies that concluded, that had been going on for 20 to 25 years, looking at women, the value of mammography. So there was a study in Canada that they did. A lot of times we can do better research there because of the national health, system allows us to get better data. But they did this study where they had thousands of women, and they put half of them did not get mammograms, and they just did breast examinations themselves, tactile, and the doctor did. And then the other half got mammograms. And they found at the end of 25 years, which is actually, you have to do studies that go out for 20 years to get accurate data on breast cancer, the influences on it. So after that time period, they found that there was no difference in the mortality from breast cancer, whether you did mammograms or not. And then they also found that there was all sorts of issues with them that, we just didn't really realize how bad it was, where it misses, half the cancers in people who have dense breasts. Well, 50% of people got, dense breasts after 50. And before that time, mammograms are worthless because you can't see through dense breast tissue, and all young women have dense breast tissue. So it's like, okay, here we have a test. I was operating on 20-year-olds. Okay, now you can't do a mammogram on them or on a 30-year-old, and barely on a 40-year-old, right? And then of course it's using radiation. And to me, it's like, okay, we're going to use a test to look for a disease that the test actually increases the risk of. I mean, that just seems insane, to me. It's just, nuts. So then the other issues are that, it overdiagnoses. So it's not very specific. When it sees something, it goes, oh, you need to have a biopsy. Well, it turns out that 80% of the time when it says you need a biopsy, it turns out to be benign. So in other words, they're unnecessary biopsies. And, women don't do well with that. I mean, it is extremely anxiety provoking when you have to have a biopsy because mammogram finds, something in there. And then more radiation, and then more mammograms and stuff. So at the conclusion of these studies, and there was another, big one that was done in the United States, the recommendation was that you should not get mammograms, because they cause more harm than good. And if you did other testing, like, thermal imaging, but no test should be used as a standalone test because no test is perfect. Thermal imaging is a physiological test and all the other ones are anatomical tests. So if we combine them, so I usually like to, combine ultrasounds with thermal imaging, so completely harmless to the body, and then also, physical examination. And there's studies showing that is more effective at, kind of analyzing the breast tissue, that way than than doing mammograms, are. So Switzerland, their medical board said they were going to phase out doing mammograms because they thought it was unethical to do a test that caused more harm than good. Now we are really locked into the money factor because we got mammograms everywhere and we got all these people making money, reading them and doing all that kind of stuff. And it's like, clearly, doing any kind of shift like that, it's like, oh, that's too scary. It's going to mess up the infrastructure of our medical system. But that's the truth of it. I mean, it's like, okay, we have the studies, and then Europe pays attention, but we don't,
It's so true.
Yeah.
Europe, I believe, outside of Switzerland, because I did see the Switzerland shift, and then Europe, I think from what I saw, was an every other year recommended, like every other country was every other year, or I think one was like every 3 years. We're the only one that's every year. And
well, they had it every other year. I don't know. They keep messing with it. And then they said, oh, don't do it until you're 50. And then they're like, wait, it's just because it doesn't work that great. To me, it's like, and they're like, oh, mammograms save lives. And it's like, because they don't prevent you from getting the disease. The whole thing is that, you try to catch it at an earlier stage, right? And I'm like, well, you know what? My mom had breast cancer and she got her mammograms every single year, and they caught it at stage 1, no lymph nodes metastasis, and all of her tumor markers were favorable. And 5 years later, she got a metastasis to her femur and she gave up and she died. So it's like, that doesn't necessarily work.
Right.
And it's, much better to have, tools where we can pick up imbalances in the body at a stage before you've developed something, and we can, interrupt that whole process. Of course, as I told you, in Western medicine, I never had a course in nutrition. So they don't even know how to interrupt the process, to create good health. So fortunately, at this point in time, we've definitely got tons and tons of naturopaths and, even integrative, MDs and so forth. And so I always strongly encourage people to also work with a more holistically trained practitioner. And in that way, you have somebody who actually understands health and creating, balance in the body again. Yeah.
Yeah. I think that's a challenge for so many right now, is the bridge, like there's so many people who are starting to really question, like, well, this doesn't make sense. And I don't really feel like I want to do that.
Right.
And then, but there's no gray space. You're either full traditional, like Western, or, and so they have this, it's really difficult to kind of manage that bridge. But the actual radiation exposure from a mammogram, I would like to kind of talk about that, because I think back to when I started questioning dental x-rays that were happening every year for an eternity. And I'm like, I've never had a singular issue. Can we just make this every 2 years like the Europeans do? And it was this big fight for no reason. The dentist was like, you're questioning my judgment. And
I do it every 5 years. I mean,
it's fantastic. I mean, and so, and the argument then was, this is the same amount of radiation as when you walk outside. And I got that same argument from my gyne about the mammogram. It's the same as you walking outside. So please talk about that, because I'm sure I'm not the only one hearing this.
No, it is not the same as walking outside. I mean, it's intense radiation. It's like a chest x-ray, multiple ones, because it's all concentrated on the breast. So it is not minor, and then we also have to talk about, well, you go and get your mammogram, but how many times they say, oh, you got to come back. We got to do another one. Now we got to do 3D. Now we got, and it's a cumulative. So here's a scary statistic. So women who have the BRCA1 gene mutation, so that's kind of the, one that Angelina Jolie had, and it's kind of the one that, we talk about the most. There's other genetic stuff, but that's the one that, carries the highest risk. So the stats are that 80% of women who have the BRCA1 gene will develop breast cancer by the time they're 80. Now, if you look in the medical, research and going back in time, we found that families of BRCA1 gene mutation people used to be only 30% of them got breast cancer. Now it's 80%. And it's like, well, why is that? And it's like, well, hello, it's our American diet and lifestyle and all the toxins and the stress and, all that kind of stuff. So if you so one of the problems with people with the BRCA1 gene mutation is that it's a mutation in being able to do DNA repair. So when we have damage to our DNA, we have all these repair systems and to fix it, but theirs is impaired. So they did these studies where they, just ridiculous stuff. And I've run into patients like this too, where because, they have the BRCA1 gene mutation, they said, oh, you should get a mammogram when you're 25 or, 30 or something. Well, first of all, you can't see anything. And then they found that even doing like one mammogram on a woman with a BRCA1 gene mutation at the age of 30, it increases her risk of breast cancer by 90%.
Wow.
Because it can't, that DNA damage, from the radiation. So they should never, have that, test with them because, it has such a terrible effect and it's way worse when they're younger, as far as the amount of damage, that occurs. So again, it's kind of rare, but there's things you can do with BRCA1 gene mutation where not only you do just kind of the general stuff as far as the healthy diet and lifestyle and all that kind of stuff, but there's certain nutrients they found that targets the BRCA1 gene mutation. So, vitamin D3, that has a direct effect on that mutation and makes it behave like it's less, mutant. And then ginkgo biloba, they found has an effect, on that gene, and it reduces the risk of ovarian cancer, which also happens with the BRCA1 gene mutation, by 60%. By taking that. I always love this stat because I'm a coffee drinker. I love my French roast in the morning. So they found that there's an interaction with caffeinated coffee and the BRCA1 gene. And so women who have that mutation, if they drink 1 to 2 cups a day, the risk of breast cancer goes down by 25%. If they drink 3 to 4 cups a day, the risk goes down by 50%. If they drink 5 cups a day, it goes down by 70%.
Sold. You don't even need to say anymore. I'll go have one right after this.
So anyway, like I said, there's things where it's like, okay, we know how these nutrients, all the testing since we, did the genome, all the testing, is on, okay, what genes are being activated, which ones are being turned off and everything, so we know that knowledge, for the genes. So you can actually target, your therapy using, natural substances to help lower the risk and, do ultrasounds and thermography and
And I want to point out to those listening that the thermography you can pay out of pocket. You do not need a physician's. I didn't know this before, but my functional medicine, I was asking my functional medicine doctor if she would prescribe it because I assumed my gyne. She's like, you don't even need it. Just go do it, and which is fantastic. And then her scan is the option for the ultrasound if you don't want to deal with insurance drama. And so I want everybody, because I know that there's already people thinking, well, there's no way I'm going to be able to get past this insurance thing. And there's always a way where there's a will. So
there is a way. That's right.
So for the people who are listening and are thinking, okay, fantastic. This is all new to me. What are my next steps? What can I do now? What would just the average person listening who's otherwise healthy, what can they do now to start helping themselves get on the right track with the right testing and the right supplementation?
Sure. I definitely think it's a really good idea for everybody to have thermal imaging once a year, as a minimum, so that we can, just kind of keep tabs on your overall health. And again, just to remember that, there's not a good standardization in the industry, and what company you go to and who you go to, makes a huge difference. So the FLIR camera, FLIR, is considered kind of top in the industry, and you want, really high resolution. You could go to my website and learn all this stuff,
And I'll include that.
What's important. Yeah, because, there's certain things I, have on there about what do you need to look for, because most people don't even think about that. So it's very important that you get, a really high quality, thermal imaging. And then, ultrasounds once a year too, I think is extremely important because it's completely harmless, but it gives us a good, look at the structure, of the breast tissue. And then as far as supplementation is concerned, there's 2 kind of generalized supplements I recommend for everybody, which is vitamin D3 and omega-3 fatty acids. So vitamin D3, there's been just a massive amount of research on it, in the last 10 years in particular, and they found that the normal value that a laboratory will say is 40 nanograms per milliliter blood level should be there. But that was actually based on bone health and rickets and all the other things that vitamin D influences, which is enormous. It's like there's so many different diseases that are associated with low vitamin D levels, and from, Parkinson's and multiple sclerosis to, breast cancer and dementia and everything. So if you get your vitamin D levels up to 60 nanograms per milliliter, there's a 70% reduction in the incidence of breast cancer, just with that nutrient alone. So that one, really, virtually everyone needs to take supplementation. Everybody metabolizes it differently. We have no idea how much you should take. It could be 2,000 international units. It could be 10,000 international units to get your levels up to that 60 nanograms per milliliter. So it's recommended to test about every 6 months, to kind of stay on top of it. Omega-3 fatty acids are equally, really crucial. Our body just functions so much better when we have higher amounts of omega-3 fatty acids. So this is fish oil and flax oil, type of thing. And so the cell membranes are made out of fat, our brains are coated in fat, our nerves are coated with fat. So we use a lot of fat in our body, and we need it. But it really makes a difference which type that you're consuming. So when you're high in omega-3 fatty acids, the cell membranes are more fluid, and they just function a whole lot better. It's also phenomenally anti-inflammatory. So there was a study that was done that looked at different substances and what their anti-inflammatory kind of factors were, and they found of everything that they tested, omega-3 fatty acids had the highest amount of anti-inflammatory properties. So that's like super crucial. They also have a lot of anti-cancer, effects, too. So there's a blood test for that one too, called the omega-3 fatty acid index, and you want it to be 8% or higher. And it varies a lot with people, as well. So I always give myself as an example. So I'm an athlete, a long distance runner and all that kind of stuff. I burn through the omega-3 fatty acids. And so the normal dose is 2,000 milligrams a day. I have to take 3 times that to get my levels up, to that, to 8% or higher. And then there's a couple different kind of more breast health specific supplements that I recommend. One is a flax lignin supplement called Bravail. So it's spelled B as in boy, R as in Roger, E as in Edward, V as in Victor, A as in Apple, I-L, Bravail. And we found that flax seeds, the lignans in the flax seeds have these phenomenal anti-cancer properties and are extremely hormonally balancing. So that's real important. And then I actually formulated a supplement back in 2005, working with one of the top, supplement companies in the industry. After I was doing all the research for my book, I found all these different nutrients like turmeric and green tea and maitake mushrooms and, grapeseed extract and things from cruciferous vegetables. Just tremendous. I mean, like turmeric's got 30 different anti-cancer properties to it. There's like 20,000 studies in the medical, research. It's the most researched plant that there is. And so I was like, hey, what would happen if we combined all these things, together? So they said, sure. So we created what's called Protective Breast Formula. I have that on my website too, but the pictures that I showed you, when I did your consultation, those were of people that we did the pre kind of, taking Protective Breast Formula and the post. So it just jaw-dropping, improvements that we saw with it. So, that's kind of like it. I'm not big on to taking, 50 different supplements. It's like you can really kind of cover, a lot of the bases with just a few of them. Yeah.
Yeah, super helpful. And I'm on board. I'm already taking all of it. So I will link the Protective Breast Formula so that you all can get that if you would like, and also the website and all the things, and your book. So your book is you have multiple books, but your book is Waking the Warrior Goddess. So talk a little bit, and there's an updated edition of that.
Yeah, so that was my first book, and that's on all the natural approaches to protecting against and fighting breast cancer. So that won a National Book Award for the best book in health, medicine, and nutrition. It's in its third edition, right now. That's one that, when I was doing all the research on what causes breast cancer, it was like, well, the way to lower your risk, it's like, that's the way to lower your risk of every kind of, chronic disease. My second book is called Radiant Health, Ageless Beauty. And it's meant to be a guide about teaching people how to become healthy. Again, I did not learn that in medical school. It's like, how do you become healthy? So it's not about diseases. It's about, okay, how do you become healthy? And, you can experience extraordinary longevity. And, to me, it's like, well, if you're going to live on the planet for a long time, I sure as heck want to feel good and be healthy. And there's ways to do that, and I think most people are aware of that, where they did the Dan Buettner, wrote the Blue Zones and went to, the cultures where got the extraordinary longevity. And it's like, well, they don't have any chronic diseases, even when they're 100 years old. It's like, there's just some fundamental truths about what it means to be a human being and what we need to do in order to have optimal health. Yeah.
Amazing. Well, thank you so much for all you've contributed already and that you're going to continue to contribute. If somebody is looking, I know you talked about the FLIR and how it's important that they choose a company that utilizes the right tools. Your company, so you read my thermal imaging and so I know for sure it's available in Florida because that's where I'm at. Where
it's available all over the world.
You're all over. Okay.
All over the world. So the company's called MedHot. And so they have, on that website, you can find, practitioners. They have a kind of a professional society that's an international, association of thermographers and medical thermographers, International Association of Medical Thermographers. And so that on their website, they have a listing of the people that have the MedHot system and the FLIR camera and so forth. Yeah.
Fantastic. Awesome. Thank you so much for sharing all of this. I am just thrilled to have done this myself and to now be on this path. And I feel already so much less anxious. And I think that there's something to be said for that, right? Like there's an intuitive, like we should trust our intuition.
Well, when I got my first mammograms, I thought, this feels like, Russian roulette. What year is it going to get me? It's completely disempowering. You're told nothing to do to lower your risk. With thermal imaging, it's completely empowering, because you can monitor your health, and we have all these different techniques to kind of interrupt that process and get your body rebalanced.
Totally different approach and so much more peaceful. And I'm all for the peace and no stress. So thank you, Dr. Horner. I so appreciate this.
You're so welcome.